Moving on, an NHS whistleblower says female patients who ask for single-sex facilities are being labelled transphobes, offenders and perpetrators, according to official NHS policy guidance. A nurse, Dr. Sinead Helyar, was speaking to a panel organised by the parliamentary campaign group Children and Women First at the Conservative Party conference, the Telegraph Newspaper has reported. She alleged that NHS trusts are gaslighting patients over the inclusion of transgender patients on single-sex wards. Dr. Helyar said that in at least one trust, if patients questioned why there was a male on a female-only ward, medics had been told to reiterate that there are no men present. Official NHS trust policy documents also compare patients who ask for single-sex spaces to racists and labels them transphobes. Staff who raise safeguarding concerns may be threatened with disciplinary action or even criminal charges, according to Dr. Helyar, who warned that the NHS is influenced by controversial LGBT charity Stonewall. She said that in one mental health trust, a male-born patient who identified as a woman had sexually assaulted patients on a female-only ward on 2 separate admissions, despite staff raising concerns. Well, joining me now is Maya FORSTATER, the Executive Director from Sex Matters. Maya, really great to have you on. What on earth do you make of that story?
It's absolutely right. This is government policy. This is NHS policy that hospital wards are supposed to be single sex for not just for safety, but for dignity and privacy. But if somebody says they identify as the opposite sex or they identify as non-binary, the nurses are told to place them in whichever ward they choose. And they're told explicitly it doesn't matter what somebody looks like, it doesn't matter that they've had no surgery. If they say, I'm non-binary and I want to be in a woman's ward, then that's where they should go.
I mean, that's harrowing. When you're, vulnerable because you're unwell, you're having an operation, you're by yourself, you're isolated, you don't have your friends and family around you, to find out that, at your most exposed and vulnerable, there might be a member of the opposite sex next to you. It's not right.
No, it's not. And not just next to you. I mean, this also includes in mental health wards, where patients are not sort of confined to bed. They're moving around, they're interacting, so it's and those hospital gowns are not they don't give that much coverage. The reason why this policy was brought in was to give people privacy and dignity when they're at their most vulnerable. And not only are they being exposed to members of the opposite sex, but when they ask questions, they're being told, no, madam, that's a woman. Or, as you say, are you a transphobe? Are you being prejudiced? Are you a bigot? That's what nurses are told to say to women who say, why is there a man in the ward with me?
Makes me utterly outraged. I mean, the fact that you had someone as well who's committed 2 sexual assaults after being admitted, it just beggars belief. Now, we asked NHS England for their response on this. We haven't had a reply. But we should say that the charity Stonewall did speak to the Daily Telegraph, and this is what they told the paper. I'm going to keep you there, Maya, so you can react to this. So Stonewall said, trans women should be able to access dignified and high-quality healthcare in the same way as everyone else. Inclusive healthcare practices make us safer, and in 2021, it should not be controversial to ensure that all LGBTQ plus people get the healthcare and support that they deserve. At Stonewall, we'll continue to work with public sector organisations, including NHS trusts, to ensure that their LGBTQ plus staff are supported at work. I mean, that all sounds relatively innocuous, but is this not essentially putting the rights of a very small minority of people who want to identify as women over 50% of the population who are women?
Absolutely. I mean, it sounds innocuous because they're not using the language of sex. They're saying that trans people who identify as transgender women should have access to healthcare. Of course they should. But the question is, should they have access to opposite sex hospital wards where other people are being told that they're in a single sex environment. And we think clearly not. We think the policy needs to be consistent. It needs to be clear. It needs to tell patients, whether they're going to be in a mixed sex ward or a single sex ward. And it needs to treat transgender patients with dignity, with respect. But it can't enter the fantasy that somebody has changed sex, because that's not possible, and it has impacts on other people in the hospital ward.
How commonplace do you think this sort of thing is? I mean, have you heard many instances of men being admitted onto female-only wards claiming or self-identifying as female?
Yes, we've heard it from patients in mental health wards, patients and their families in, just ordinary wards, elderly care wards, sometimes feeling uncomfortable as to why there's somebody who they can clearly see is male in the hospital ward with them. But, people are feeling vulnerable, they're feeling confused. They may not necessarily be able to make a complaint, but they don't feel happy. And then we've talked to nurses who are, they know that this is not what they should be doing. They should be looking after their patients. They should be recording accurately what sex people are. They should be doing risk assessments based on accurate information. And they can't do that because they have to follow this policy. And NHS hospitals, the way this policy works is if you do, for lack of space reasons or some other reason, put a man into a women's ward, then that NHS hospital is fined. So that's how the policy works. But if they put a non-binary male into a women's ward, they're not fined at all. And if they put that non-binary male into a men's ward, which is not that person's preference, then they're fined. So it's not that the individual hospitals are freelancing on this. They have this policy that's come from on high, from NHS England, that tells them to do this, that tells them to gaslight patients, and it's not what nurses want to do.
No. Maya, thanks so much for coming on and talking about this. It's a horrific development.